Well, welcome back to Better Living. I'm here with Annette from Hospice of Northwest Ohio. She is a physician there, and you work with palliative care.
Right.
Can you explain to people what that is?
Palliative care is actually a medical specialty, and we focus care on patients who are chronically or seriously ill. And just like hospice care, we concentrate on symptom management, addressing any symptoms such as pain or shortness of breath, anxiety that might be related to the disease. But we also focus on a patient's goals, making sure that the goals that they have for their medical care aligns with what the physicians and the medical community is doing to them or doing for them. So communication is a big part of it also.
In the case of setting their goals for what they want to happen while they're at Hospice of Northwest Ohio or in the care of Hospice of Northwest Ohio, if somebody's thinking about that, is it more whether or not they have a do not resuscitate order, or is it things like that? What kind of goals would we be talking about?
You bring up an important point of hospice, because hospice and palliative care, although they have some similarities, are really quite different. At Hospice of Northwest Ohio, of course, we've been a hospice agency for many years, and hospice care is a type of medical care that focuses and cares for those patients who are dying. It's a type of care that, of course, emphasizes the quality of life, pain and symptom management, but it's for those patients who are at the end of life. Unfortunately, some people feel that end of life means the last days, and when I talk to people, sometimes they think if we bring up the word hospice, that means
it's going to happen now.
It's going to happen now, when in fact hospice can help a patient and a family throughout the last months of their life, making sure that whatever time they have is the best quality of time. Palliative care is a little bit different. Although, as a palliative care physician, I'm part of Hospice of Northwest Ohio, we now have a palliative care division. Palliative care is a little upstream from hospice, meaning we also focus on symptoms. We want to make sure patients, pain, shortness of breath, anxiety is well controlled. We take care of not just the patient, but also the family. But palliative care is for any patient that's dealing with a chronic or serious illness, and they can still be getting aggressive medical care. They're not at the end of life. They're still seeking a cure, perhaps, or, still want to go back to the hospital and have more aggressive care. But as a palliative care physician, I communicate with patients and their families to make sure that the care that they receive aligns with what they want. We always say in medicine, just because you can do it doesn't mean that you should do it or have to do it, and help sorting that out for a patient and family.
If someone is in that situation, and perhaps it's the family member that's in the situation helping as a caregiver, or the patient themselves, and they have that chronic illness, but they're not in the end stages of life, is that something, if they want palliative care through you, do they go through hospice still?
Right. Our palliative care service is through Hospice of Northwest Ohio, so they can call there and ask for the palliative care service. The palliative care is a consultative service, meaning we work together with that patient's primary care physician. So that physician asks us to see their patient, and we work together to, again, meet the patient's goals and make sure that their quality of life is good as they're going through treatments. For example, a good example is a patient who's going through cancer treatment. They're getting aggressive care, they want chemotherapy, they're getting radiation, but there's some burden of disease. Patients going through that have symptoms, have stress, anxiety, questions, and that's one of the examples where palliative care can have a role.
Talk about how important that communication is between you and the patient and the family or caregivers, because whether they're in the palliative care situation, they're in the hospice and it is the last days, or there are no last days, coming, they're still in that aggressive treatment stage, that communication is essential.
Good point, and I see it all the time that, again, regardless of whether a patient is in their last days or still wanting aggressive care or, more advanced care, the healthcare system can be overwhelming.
Mm-hmm.
And like I said before, we can offer many different things. And being able to communicate to a patient and family, so that they understand their disease, communicate with them so that we understand what's important to them, and then we align what's important to them, how they want to spend, whether it's months or whether it's many years, how they want to spend that time and what they want to go through to keep good health or to keep comfortable.
I think it is, it's overwhelming, and sometimes it's that subject that nobody wants to talk about and nobody wants to address.
That's definitely the case, right.
Well, if you need to address that subject, whether it's because you need palliative care in the treatment stages of a chronic disease, or perhaps it is the end dates of someone you're caregiving for, all you have to do is call Hospice of Northwest Ohio, and they can help you through that situation. We'll be right back on Better Living.